here with Dr. Reams Concierge PT. I'm here with Erin Westner. Have to remember that.
Married as of last year.
Yes. So she is a pelvic floor physical therapist, and she helps treat some women post-oncology treatments, breast cancer treatments. So I brought her on to talk about if you have a problem, what does that treatment look like? I've talked a little bit about it before, but this is what she does. And so she has more knowledge and a fun way of explaining
more
things.
Knowledge, but yes.
I think so.
Yeah, so I'm excited to be here. So yeah, welcome. Hope you learned something.
Yeah, so if someone comes to you that they're having pain with sex, right? So that's one of the common diagnoses. Yep. What would their treatment look like? How can you help them? Stuff like that.
Yeah, so a couple of different things. Like your first session would be more of an evaluation to see like where is the pain coming from. We want to look at all the different things that could have gone on. So like, was there any surgical procedure that was done? Is there scar tissue in your belly? Is there anything else old that might be playing into this too?
Those kids?
Those children, yeah. So all kinds of ththings that we're looking into and checking. So the first session is more like, is it their tissue quality from lack of hormones? Is it more just like the surgical procedure? Is it the muscles that said, no, not really happy with this? Radiation, or even just like a neuropathy that could be happening from chemotherapy. So all of the things we kind of like delve into figuring out where is it coming from, and then that indicates how we treat it. So if it's tissue quality, there's several things that we do for tissue. So bringing blood flow to the area. So we do a lot of soft tissue, a lot of like skin rolling. We can do
different types of massage.
Massage techniques, basically. Yes. I'll get technical with you. But yeah, so there, like, just anything that we can do to kind of like open up the blood flow, open up the tissue, and get that improved quality. And then any like type of hydration, so vitamin E versus like different types of salves or like lotion stuff that you could use for those tissues and down there that are more appropriate than others. So we talk about tissue health and quality there, lubrication, things like that. So that's one.
Yep. So are they always going to have someone inside them working on them, or?
Absolutely not. So that is based on your preference and your comfortability. We do tell patients that an internal exam can be beneficial. However, if you don't tolerate it, or you're just not really comfortable with the thought of it, or for whatever reason, it does not matter, you can absolutely say no, and we can find ways around it and give you homework to do and things like that that might entail a little bit more internal work. I also teach significant others how to do work on you as well, because I think that's the best. It's the best way to kind of get back in touch with somebody after all of that, because you feel fragile after a surgical procedure or like any treatment in that area, and they feel like you're fragile as well. So being able to incorporate them in the treatment is very beneficial for both parties. So
yeah. And this is Erin here in town in Chattanooga,
yes.
But most physical therapists that treat this will say the same thing. It is your comfort level. It depends on what you and your therapist discuss.
Yes.
So
work out a plan with them. That's
yes.
the idea.
Yes. Now, if someone comes in and maybe they don't think this is from the oncology treatments, but they're like, oh, don't make me laugh, I'm going to pee myself. Or I can't jump on the trampoline with my grandkids because I'm going to wet myself. Well, this can come from some of the oncology treatments.
Correct. Yes.
Some just have this from before and think it's normal.
Yes. Not normal. It is something that's very common, and it can get worse post-oncological treatments. Words. Sorry.
Cancer treatments.
Post-treatment. But anyway, so yeah, so there are things that happen with our tissues and our muscle strength. And or tension, because we can have either or, and that's the goal of your physical therapist, is to find out whether or not those muscles are working appropriately, whether they're relaxing all the way and whether they're squeezing the way they should be, or if you're using all of your muscles, because there's actually 22 muscles in the pelvic floor. So you need to make sure all of them are functioning the way they should.
And so, does someone need to go see their doctor first to come see a PT?
Absolutely not. In the state of Tennessee, if you're, and it really just depends on your insurance too, but the first session is absolutely okay to see a physical therapist first. And then we can give you instructions or anything like that if you do need that for insurance purposes or for just like for any other reason.
So if you're watching this in the United States,
Yeah.
this will be on YouTube, so potentially somewhere else, right?
So anywhere else.
But in the United States, physical therapy, you can go see a physical therapist for at least one visit in all of the states. Each state has a different rule, but you can go see a PT without a doctor's note for at least one visit in all of the states.
Yes.
Tennessee, we have a little more freedom.
Yes. We could see you for a larger amount of time.
Yeah.
And the state of Tennessee, thank goodness, we also changed the rules. It gives us even more freedom with that. So, but yeah, each state is different. You have to check to see what your, you can talk to your PT. Your PT will know as well what the rules
Give them
are.
a call and they'll let you know or go in and see them. So let's say someone has a mastectomy. Okay, they have scar tissue, but they started noticing some pelvic floor problems. They haven't had radiation, they haven't had chemo. How is that connected?
So they haven't had surgery and they haven't had chemo.
So they had the mastectomy, they haven't had chemo or radiation.
All right. So with a mastectomy, all the scar tissue that you have built up in that area, there's something called fascia, which is basically spiderweb-like tissue that goes and kind of interwebs all over the place, all over your entire body, and it all connects. So if you have a scar up here, it actually pulls all the way down in different directions. So you could even have like some mid-back pain, you could have some belly pain, you could have some hip pain, and it can radiate from that scar tissue. It's basically like a tightening of a rubber band, and it's got to be pulling from somewhere else too.
So it is absolutely possible if you've only had a mastectomy to have pelvic floor complications. You don't have to have the other treatments for that to relate. And so that was one that most people don't put that together, so I figured I'd ask you.
Yeah, absolutely.
You're great at that. So Erin is here in Chattanooga. She has her own practice. Like I said, they treat pelvic floor complications. That's their bread and butter. They know what's going on. I will put her website in the description, but it is
The Pelvic Method, and you can look us up at thepelvicmethod.com.
And social medias and all that. They have some great videos and information, all that stuff too. Thank you,
I
Erin.
appreciate it, Kaylee.